Good day to all my viewers. This is a video to explain out the complexities of the diagnosis of pregnancy. We have many modalities of diagnosing pregnancy, but it causes confusion in the hearts of a lot of people. I'm Dr. Shobna Mohandas. I'm a gynecologist practicing at Thrissur, Kerala, and I would like to explain the intricacies of how to know if you have a viable pregnancy or not. Earliest indication of pregnancy is, of course, a missed period. And but missed period is not synonymous with a healthy pregnancy coming out. So you need to do a pregnancy test, which is the commonest way of doing things. And next is an ultrasonography. A pregnancy test is best done with the early morning urine, but these days the tests are so sensitive that even at other parts of the day, it can come positive. You add 3 drops of urine in the place provided. If you see 2 lines, there is a pregnancy. If there's only 1 line, it's a control line. So that's a negative test. But if there's a 1 line is dark and 1 line is light, it still is confirmatory of pregnancy. But the hormone which causes this line, HCG, is a bit low and it will come dark after 1 week. You have to repeat it. So basically, 2 lines is confirmation of a pregnancy. If the line comes in the test group initially instead of the control group, then also it's not a good kit. Or if you don't see any line at all, then again it's not a good kit. The 1 line has to come in the control and the next line has to come in the test, which is marked with T. So there are 2 lines. Now, once you see 2 lines, everybody wants to know if the ultrasound will show that all is well. They can't wait. Generally, the ultrasound will show a fetus with a good heartbeat only 2 weeks after missed periods, and you have to wait till that time. By then, you can generally see a fetal pole. But then, if you don't see a fetal pole, again there is apprehension. Please understand the gestational sac, that dark round that you can see here, it has to be at least 20 millimeters before you can see a fetal pole in that. So if there is a delayed ovulation and the periods are delayed for some reason, even in women who have normal periods otherwise, if for some reason it is delayed, the sac will come at a later time. See on this second picture, you can see a small sac, 7 millimeter, at 6 weeks of pregnancy. That means where you should have seen a fetal pole, only a sac is seen, but it is only 7 millimeter. But because it's only 7 millimeter, you could wait, and after 2 weeks, that patient could properly see a fetal sac with a fetal pole and heartbeat and everything. So there you have to wait. Suppose it's negative. People come and ask, doctor, I have missed my periods and I always get regular periods, and this is the first time I missed my period and the pregnancy test is negative. Tell me what is wrong with me. The number of reasons why it can go wrong is so many that just that one sentence is not enough to tell you what is wrong with you. There are many investigations to be done before we can pinpoint what it is. Stress can cause it, malnutrition, not eating, not feeling hungry, all this can cause it. Even obesity can cause delayed periods. PCOS, where all the eggs try to grow at one time and there is more insulin in the blood. That's a disease very common these days. That also causes delayed periods. Hormonal imbalance like high prolactin or low thyroid levels can also delay periods, just like lactating mothers who are feeding their babies can have delayed periods. Even tubal pregnancy can have delayed periods. There are many, many more conditions, and to pinpoint on one sentence is not possible for any doctor. I've missed my periods. Tell me what is wrong with me. One sentence is not enough to give that one idea. Even delayed ovulation. Normally, a woman ovulates by 14 to 16 days of her periods, but sometimes due to some reason, the ovulation may be delayed. In that case, the periods will come on later. And at that time, if you test your pregnancy test, it will come negative. But the pregnancy is about to come and it may become positive later. So, without knowing whether you're pregnant or not pregnant, we need to find an answer without investigating a woman too much. So, the best thing that doctors do is to prescribe progesterone tablets, which will bring on the periods if the woman is not pregnant. But please understand, progesterones can never harm the pregnancy. So, if you are a person trying for a pregnancy, it will not cause an abortion. So, these pills can be taken very safely, even if you are a person planning pregnancy. In no way will trying to induce a period with progesterone ever harm a baby which is in development, which is not found only because she has had a delayed ovulation. Another problem is instead of delayed ovulation, there was a pregnancy, but it went off. That's called a chemical miscarriage. It will never come on ultrasound because it's not growing. It could have been because of chromosomal or genetic abnormalities, and the body is naturally trying to terminate it. And this normally happens 1 week after expected date. And sometimes the patient gets cramps, so that also causes confusion whether it is period cramps or it is cramp of abortion or it is tubal pregnancy. All those apprehensions will go off, but once you get your periods on straight, please understand that every time the chromosomes are not going to go bad, and you can definitely have a happy pregnancy in your next pregnancy. It's not a recurring condition. But to understand whether it is delayed ovulation, whether it is chemical abortion, whether it is just delayed periods. So all these things confuse us patients and we need some way out. No line, I told you, is not pregnant, but sometimes one dark line and one light line is either delayed ovulation, which can develop into a viable pregnancy, or it is a non-viable pregnancy where the embryo is formed but cannot grow into a baby and abortion may happen. So the differentiation can be done with a hormone called HCG. We all know that pregnancy starts when the zygote or the mixture of the ovum and the sperm goes and sits in the uterus, which is called implantation. And after a few days, there is blood vessels forming all around it, where the blood between the mother and the fetus can be exchanged. This is called chorion. And the hormone developed by the chorion is chorionic gonadotropin. And in the human, it's called human chorionic gonadotropin, or in short, HCG. So if you measure the HCG, uh, you can find out if the woman is pregnant much before. Chorion is formed at the time of the missed period, and so at the time of missed periods, the HCG will start rising, and the values the doctors will know, and understand that it will come positive in the blood much before it comes positive in the urine. And plus, you can quantify it. In urine, you can't quantify it. You can only see 2 lines. So when there are 2 lines, or when there is a half line, you can do an HCG test so that you can quantify it. Suppose you have missed your periods, the uterus is not showing changes and there is a bleeding. Now people want to know if it's a bleeding or it's an abortion. So to understand that, you can quantify the HCG values by taking blood one day and once 48 hours later. And if it is rising, it's a good pregnancy. If it is falling, it's not a good pregnancy. Again, if you have one dark line, one light line, again, you want to know if it's a viable pregnancy, even without bleeding. Here also, you can either wait for 1 week before the line becomes 2 dark lines, or you can do 2 HCG tests 48 hours apart. Doubling means it's a good intrauterine pregnancy, and falling means it's a failure. So you can find out even before the ultrasound is done. The HCG comes then at how long you have to wait for ultrasound to confirm it. Ultrasound will show a sac only after HCG level reaches 1000. So if you have 100 or 500 HCG, there is no point in going and getting an ultrasound done because it will not show a proper gestational sac. And in ordinary women, it will happen only 7 days after missed period. But anyway, you have to look for the heartbeat 14 days after missed period. So why not wait till then? That would be the sensible thing to do. Do your first ultrasound when you expect a fetal pole with heartbeat. Quite often, when there is a light positive test and there is abdominal pain, rightly, there is a fear that the pregnancy is in the tubes, and that rings alarm bells in the woman. Here, you have to again wait and observe with under a doctor, because everybody is worried that tubal pregnancy will rupture and be dangerous to life. But it's not true. Up to some extent, there is something called conservative treatment of ectopic pregnancy, where you do not have to give medicines, you do not have to operate, you do not have to do anything. It will just go off on its own. But that's only to some extent of HCG, and it has to be done under the supervision of a doctor. That doctor will correlate the HCG, the symptoms, the ultrasound, and everything, and find out what is right. And everything cannot be explained to the patients in those cases. When the doctors are repeatedly doing HCG tests and ultrasound, the patients feel that they don't understand anything. Why are they testing me again and again? We have to understand that science has advanced a lot, but instant answers are not possible sometimes to the patient's expectation. So, whatever available scientific evidence is there, that is used by the doctor, and sometimes to give an answer, repeated testing may be necessary, and the patient has to patiently wait till the doctor gives a correct diagnosis. And because all these tests are available, repeated tests may be needed to come to a right diagnosis. You have to wait patiently before you know what is wrong. Thank you for a patient listening, and I hope that has cleared a lot of doubts in your mind. And wish you a good day once.